Hello, my topic is about pulmonary forain granulomatosis. First, we have to talk about the definition. The pulmonary forain body granulomatosis is a rare disorder characterized by the development of granulomatous inflammation secondary to foreign bodies lodged in the pulmonary capillaries. Here's a small video about what granulomatosis is.
Wegener granulomatosis is a small vessel vasculitis, and the vessels that are affected are isolated to the lung, the nasal passage, and really the entire tract down through the lung. And the kidneys are affected. So really, lung and the tract and the kidneys are affected in Wegener granulomatosis. So think about what happens if you damage anything along this tract along with the kidney. If you damage small blood vessels in the nasal passage, you may get bloody nasal discharge. If damage gets severe enough, you can cause disruption and deformity to the nose. It'll look kind of like its cave image causes decreased filtering of the kidney. Its wall cells escape really readily, known as granulomatosis, to filter the blood. Now, so you want to think small vessel vasculitis, just like Wegener's. Now, microscopic polyangiitis is different from Wegener's because you see P ANCA instead of C ANCA, and around 80% of the patients will have this P ANCA. Why you get a different type of ANCA, anti-neutrophilic
Well,
cytoplasmic
here
antibody,
the bit
is
explains
really unknown.
the many
But a
types
good way to tell the difference
granulomatosis, but
Another great
the
way to
type
tell
of
the difference is
granulomatosis that we
microscopic
want to study
polyangiitis
is
only affects
pulmonary.
the lungs and the kidneys.
Well, let's move on. What are the applications in medicine? Uh, this disorder is caused by intravenous injection of crushed pharmaceutical tablets intended for oral administration. These tablets typically contain insoluble binding agents such as talc, that is hydrated magnesium silicate, microcrystalline cellulose, and crospovidone. When these materials are injected intravenously, they become irreversibly trapped in the lungs and they produce angiocentric foreign body granulomatosis inflammation. Here's another video about granulomatosis. Let's see.
Cold or life-threatening like pneumonia or pulmonary embolism. Granulomatous lung disease is a vasculitic syndrome that results due to an increase in ANCAs or anti-neutrophil cytoplasmic antibodies, abnormal circulating antibodies, affecting the blood vessels in and around the lungs. The pulmonary or respiratory system within the human anatomy is dominated by the presence of the lungs. This essential organ pair facilitates the exchange of carbon dioxide-infused air for pure oxygen. Located on either side of the heart, the exchange of gases takes place in specialized cells of thin-walled air sacs called alveoli. In mammals, when inhaled air progresses through some particles or pills, stenosis pulmonary hemorrhage, did via detailed clinical of pulmonary hemorrhage periodical monitoring of the white blood count.
And what's the issue in Ecuador? Pulmonary foreign body granulomatosis tends to, most often, affect males in their fourth decade of life. Presentation of patients with pulmonary foreign body granulomatosis can range from asymptomatic to fulminant. Symptomatic patients typically present with varying nonspecific complaints, including progressive exertional dyspnea and dry cough. Here's the last video about granulomatosis. Let's see.
Here is another lung. Notice, here's the pleural surface, here's a cut surface, here's some more pleural surface, here is some fine subpleural stippling by anthracotic pigment, which is very common, almost to the point where I could say it's normal. And here's another cut surface. Notice in this portion of the cut surface is a consolidated yellowish area. If you were to take a microscopic view through this area, you would is that it's because it is large granuloma. Here is some normal lung out at the periphery, and here is the inflamed.
What the video wants to show you is the granulomatosis, as you can see in the lung tissue.
Let's look at it a little bit higher. You can see that a large portion of the granuloma is necrotic, even from this power, and that you really could not make out the outlines of the cells too well. And all you see are remnants of inflammation.
In conclusion, the treatment of pulmonary foreign body granulomatosis is supportive. Most patients develop a progressive decline in pulmonary function. Successful steroid use has been reported in one patient, but further data were lacking. Associated pulmonary hypertension can be treated with vasodilators. Lung transplantation can be considered, however, those patients undergoing transplantation must be closely monitored. Thank you.